Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth in Didi, Smartwatch Heart Monitoring Secrets. And trust me, it's juicier than your cousin's peach cobbler. Your smartwatch could save your life, but 80% of people ignore the most critical heart data it's tracking every day. I see patients all the time who've got these fancy devices strapped to their wrists, tracking everything from how many steps they took to the bathroom to whether they breathed funny in their sleep. But they're completely missing the goldmine of heart health information sitting right there on their wrist. It's like having a Ferrari and only using it to check the time. Let me break down the big three heart metrics your smartwatch is secretly whispering to you every single day. First up, resting heart rate. Now, the textbook says 60 to 100 beats per minute is normal, but here's the thing. I care way more about your trends than any single reading. Think of it like your weight. One heavy dinner doesn't make you overweight, but if the scale keeps creeping up week after week, we've got ourselves a conversation starter. Second, heart rate variability, or HRV. This little gem measures how well your heart recovers from stress, and unlike your teenager's attitude, higher is actually better here. When your HRV is good, it means your heart is like a jazz musician, flexible, adaptive, responding beautifully to whatever life throws at it. Third, those irregular rhythm notifications. These can catch early atrial fibrillation, and let me tell you, catching AFib early is like catching your spouse before they spend your entire paycheck at Target. Timing is everything. Now, when should you actually pay attention to these numbers instead of just admiring how pretty they look on your wrist? If your resting heart rate suddenly jumps 10 or more beats per minute and stays there for several days, your body's trying to tell you something. Maybe you're getting sick, maybe you're overtraining, or maybe you've been stress eating too much of that peach cobbler I mentioned earlier. When your HRV drops significantly, that's your heart saying, "Hey buddy, I need a vacation." It's a sign you need more recovery time. Don't be a hero, listen to your ticker. And here's the big one. Any irregular rhythm alert should have you calling your doctor faster than you'd call your mama if you saw a snake in your kitchen. Don't dismiss these alerts. I can't make this stuff up, but people do it all the time. Speaking of not making things up, let me tell you about a real patient of mine. 45-year-old guy, fit as a fiddle, out for his regular morning jog when his Apple Watch starts buzzing like an angry bee. AFib alert. Now, this guy felt absolutely fine. No chest pain, no shortness of breath, nothing. He almost ignored it completely. Almost. Thank goodness his wife has more sense than he does and dragged him to the ER. Yep, entirely true. The ER confirmed he was in a serious arrhythmia that required immediate treatment. That little computer on his wrist literally prevented a potential stroke. His smartwatch was a better wingman than his college buddies ever were. Now let's talk smart monitoring habits, because obsessing over these numbers like they're stock prices isn't going to do your mental health any favors. Check your trends weekly, not obsessively daily. Your heart rate doesn't need more attention than your social media feed. Screenshot any unusual readings to show your doctor. We love pictures almost as much as we love patients who actually follow our advice. If you're getting false readings during workouts, try putting your watch in airplane mode. Sometimes these devices get more confused than a GPS in a tunnel. And remember this, your smartwatch is like a really smart friend who gives great advice, but they're not your doctor. The technology supplements medical care, it never replaces it. If your watch is constantly telling you something's wrong, maybe I should see you in the clinic. We need to talk. Here's your actionable takeaway for this week. Enable those heart notifications on your smartwatch if you haven't already, and establish your personal baseline numbers. Write them down, screenshot them, tattoo them on your forehead if you have to. Just know what normal looks like for you, because when something changes, you'll spot it faster than a hawk spots a field mouse. Your future self is going to thank you for paying attention to these digital breadcrumbs your heart is leaving you every single day. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.